Simply Medicine on 55 KRT detox station. Well, a lot of people are racing to get some procedures done before the end of the year so they can meet their deductibles and have insurance cover these procedures. One of these procedures is a vasectomy. That's where men basically make it so that they won't be able to reproduce anymore. And joining me to talk a little bit about this is a reconstructive and prosthetic urologist. He is Dr. Paurush Babbar. He's been on the show before, and he works with the Urology Group here in Cincinnati. So Dr. Babbar, welcome back to Simply Medicine.
Hey, thanks for having me again. Pleasure, and looking forward to this conversation.
Yeah, me too. I didn't give a very clinical, explanation of what a vasectomy is. Why don't you explain that to us?
Yeah, so a vasectomy is a procedure where we cut the vas deferens. So what that means is that it is a form of contraception that men can use for permanent sterility. And essentially, the testicles, they make the sperm, and it goes into a structure called the epididymis, and then it is transported through this structure called the vas deferens to the prostate, and then from there on out. And so this is a pretty quick and seamless way to block the passage of sperm in the ejaculate, and is a common method for preventing pregnancy once patients have decided that they're done with that aspect of their life.
Is there any other benefit to getting a vasectomy other than preventing pregnancy?
No, I mean, that I think is the main reason it is done, but the reason that I think it is common with 175,000 to almost up to 500,000 vasectomies done annually is that it is a very easy way to achieve this with very few complications. So essentially, it is still the fourth most common used method of contraception behind condoms, oral contraceptives, and tubal ligations. But what we have to understand is that vasectomy is about 99.7% effective at preventing pregnancy. So there is about 0.2 to 0.3% of patients who have to have it redone because the ends of where the procedure is done can grow back together. But generally speaking, the rate of pregnancy after vasectomy is in estimates is 1 to 2 out of 2,000. So it's an extremely successful procedure when done in the right hands, and I think that's something that our listeners should know about, and something that we certainly offer at the Urology Group.
We are here talking with Dr. Paurush Babbar. He is a reconstructive and prosthetic urologist at the Urology Group here in Cincinnati, and he is talking with us about vasectomies. So about how many of these do you perform each year?
So estimates are that urologists nationwide perform anywhere from about 200,000 to 500,000 of these annually, but 75% of vasectomies in the United States are done by urologists. And at the Urology Group, we're doing easily a few thousand every year between all our 30-plus providers. And so it's something that we offer at all our locations, and we do a large amount of these, yeah.
So is it, a fairly quick procedure? I know there's some recovery time, obviously, but does it take just a short time to perform this?
Yeah, no, so what I tell patients is, it takes about 15 to 20 minutes to perform, interestingly, and so every practitioner in our group will do it, a slightly different way, but, the way I do it is they come in and we, shave the scrotum, we put a warm towel on the area to kind of make it a little bit of a more hospitable, area for the procedure, and then we numb the scrotum, and then we make a small opening in the skin without a scalpel, and we grab the vas, and then with a combination of clips and ties, we occlude the vas, cut out a segment, and then essentially burn the ends of it so that it has two forms of occlusion, that it hopefully is not one of those 0.24% of cases that has to be redone. And then we put it back in, and then so some practitioners do it through one opening, some do it through two, but it's a very well-tolerated procedure, and complication rates are quoted as being only 1 to 2%, and these are generally not life-threatening or even close to that. Those 1 to 2% of patients may get a blood collection in the scrotum. That's generally seen if you maybe start your physical activities too quickly, which we say to refrain for about 5 to 7 days after, just to be really safe. Small risk of infection, also less than 1%, but we give antibiotics at the time of the procedure to help mitigate that at times. And then there is a 1% chance of a entity that patients may have heard about, which is called post-vasectomy pain syndrome. And so once again, very rare, but much less than that 1% need any intervention for that. And generally that's not a long-lasting issue. So it's something that I think patients should generally consider because, we have data that there's even about 3 times more patients use tubal ligation as a form of contraception. So this is where the female partner actually has to have an abdominal surgery under a general anesthetic generally to tie the tubes per se. And so the vasectomy is a lot easier to do. It's in the office, 15 minutes under local anesthetic, a lot less risks, and it's a lot cheaper to do. About all the large databases show it's 3 to 4 times cheaper than doing a tubal ligation. So it's something that patients may not even know about, and it's something that we want to educate the public that this is an option.
Do you also perform reversals?
Yeah, so urologists do perform vasectomy reversals. Now, the one thing I would talk about with that is that if a patient has any thought that, hey, we may want another child, then we generally recommend, hold off the vasectomy, because the vasectomy is a quick 15-minute procedure with 99.7% success rate, let's say. Now, a vasectomy reversal is a much more challenging procedure because you have to get 2 really small tubes and tie them back together. And so the success rate on that of getting sperm in the ejaculate is 85%, but a lot of estimates say that the chance of getting a viable pregnancy after a vasectomy reversal is 55 to 60%. And so it's something that's quite challenging and doesn't have the best results even in the most skilled of hands, just because it's just so challenging of a procedure. And then also not something to discount is that it's generally not covered by insurance, the vasectomy reversal, and it can be $10,000 or so out of pocket. So it's something that people should really think about, before they undergo a vasectomy.
Yeah, yikes. You said 10,000 and I'm thought, oh gosh, make sure that's really what you want. Dr. Paurush Babbar, reconstructive and prosthetic urologist with the Urology Group here in Cincinnati. Thanks so much for talking with us today about vasectomies. And we know that the NCAA the championship time is a big time for these, so guys can hang out and lay around and watch some basketball, but also end of year. So, thanks for joining us to talk with us.
Absolutely, and thanks for having me. And please come in and talk to us, and then we'll take it from there.